All right, welcome everyone to the Sahlgrenska Global Health Hackathon. And today is going to be all about challenge number 3, Forever Vital, Innovating Solution for Healthy Aging. So we are not going to steal much of your time today. It's going to be like last time. It's going to be 30 minutes. So after my short welcome here, and also the house rules, we will give the floor to Jamie Smith from Sahlgrenska Science Park to give you some more information about the hackathon. And then finally, we will have our amazing speaker, Axel Wolf, who will talk about the challenge number 3, Forever Vital. Axel is a director of Gothenburg Center for Person-Centered Care and is also a senior consultant at the Sahlgrenska University Hospital. So as exactly happened last time, we will also give you some time for the questions that you might have. And then we will wrap it up and then we can all continue with our day. So let's go talk about the house rules. So as you noticed by the notice at the beginning of this meeting, this live session is being recorded and will be made available on YouTube and Event Tornado under the live session tab. So you can all find it, whatever your local hackathon is, you can all find it there. You can ask your question using this meeting, using the chat that you have here on Zoom. At any point during the meeting, but the questions will be addressed at the end of the live session by the agenda that I told you before. So, further ado, I would like to introduce Jamie Smith. He's a communication consultant at Sahlgrenska Science Park. I know that many of them already know you, Jamie.
Thank you so much, Michele, and it's great to be here this afternoon here in Sweden. I guess it's the evening in Singapore and lunchtime in the US. So yeah, welcome to this inspiration and information webinar about Sahlgrenska Global Health Hackathon. So if you could move the slides along, Michele, that'd be great. Yeah, so what is the Sahlgrenska Global Health Hackathon? So yeah, it's a lot of fun. So we did a hackathon here in Gothenburg in April, focused on femtech and closing the gender health gap. And you can see some of the pictures there and that energy and that spirit that comes up when people who don't necessarily know each other get together to collaborate and innovate. It's contagious and so exciting. So based on that experience, we wanted to go bigger, to go broader, and to go global. So now we're launching the Sahlgrenska Global Health Hackathon, and it's a series of on-site weekend innovation hackathons taking place during the spring of next year, and ending with a grand final in Gothenburg in October. So it's a year-long event. Some of you, we've been getting a few questions about what is a hackathon, and so we've got a nice little explanation there as we describe this hackathon. So it's an event where people come together to collaborate to solve a problem or identify new opportunities, and anyone can join and they can make a difference. So you don't need to be a coding expert. So no coding, no problem, and everyone is welcome. Researchers, students, clinicians, entrepreneurs, other industries. It's really a very inclusive event, and we just want people's ideas. We just want people's interest and insights, and then we bring it all together and kind of see what happens. That's where the magic is. Yeah. So, and why are we doing this? It's because we need fresh new ideas to tackle some of the most urgent healthcare challenges of our time. So it's a very noble mission, but we're very excited about the global power that we're bringing together to make this happen. Yeah, maybe we could, I can see the countries there where we're visiting, and you can see we'll move on to the next slide, please. We can take a look at the challenges that we're zooming in on with this hackathon. So it's health equality, fighting cancer, Forever Vital, which is the focus of today's session, infection prevention and control, smart, safe, and sustainable healthcare. These are the 5 global health challenges that we have selected and asking people to focus their energies on. Yes, and without further ado, maybe the next slide, please, Michele. I'd love to introduce our guest here today. And as I mentioned, this webinar is all about challenge number 3 in our hackathon, which is, we're calling it Forever Vital. And this is all about how we can support healthy aging in a rapidly growing elderly population. And with us today to inform and inspire you, we have Professor Axel Wolf. And as Michele said, he's a director of the University of Gothenburg Center for Person-Centered Care. And he's also, not just that, but he's also a senior consultant at Sahlgrenska University Hospital. And Axel's going to discuss person-centered strategies for healthy aging and chronic disease management as we aim for more equitable and sustainable healthcare systems. So with that, sit back and enjoy some inspiration from Axel. Over to you.
So great. Thank you so much for the invitation and also for the presentation. And now I hope that you see a PowerPoint called Forward More Equitable and Sustainable Healthcare System. Is that correct?
Yes.
Perfect. So like I said, so one of my my mission here today is to inspire you and also give you at least my view on healthy aging and chronic diseases. And the focus will be on equitable and sustainable healthcare systems. So systems are important here. And I mean that it's a huge mission. I mean, it's almost over 40 million people die annually on chronic diseases. And so this is one area that I think is hugely important to understand and to improve. And just a little about our center. We are a national research center for person-centered care, founded in 2010 by the Swedish government. And we have around 200 national, international researchers. And we look at both the effects and the efficiency and the utilization of person-centered care and patient public involvement. So on our site, please visit it if you want to. And we have a lot of research, but also online tools, the European Standard for Patient Involvement, systematic review databases, online training courses, which could be of help when you join the hackathon. So first, I want to start about talking about time. I mean, if you talk about aging society and elderly, you need to see about time. Okay, it's what we know is that we will be born and we will die. I mean, that's something that we know. But we also know that time is relative, yeah? So it's not equal. And that's important to understand when we talk about equitable healthcare and think about equality. But it also is true that time speeds up when you get older. So the older you get, the less time you have. So, but it's also about existential time. So these are things that maybe you could consider when you talk about aging in today's world. And we try to manage and optimize time. And I think that we go from more time to live to more life to time. And maybe it's not a 0-1 aspect here, but it's in that continuum that we are going to talk about it. And I think that one of the major challenges that we have in many of the healthcare systems that we have today is that we need to go from more reactive healthcare to more proactive healthcare, which is also interesting when you talk about vital aging. So I will talk mainly about my piece today, which both is about prediction, prevention, promotion, on top of diagnosis, treatment, and rehabilitation. And that's also part of the precision health and precision medicine movement, where we now are able to more precise, both predict and hopefully also prevent and promote a healthy lifestyle. So we all know that a change must happen. I mean, we live longer, and because we live longer, many of us will have long-term illness or chronic disease. But it's also true that, and I think that's very important here, that aging itself is not a problem here. So elderly people are not the problem. So in Sweden, we have a long-term population-based study called the Age 70 study, where we also seen that today's 70-year-old people are like the 50-year-olds 30 years ago. So we also need to change our perception of elderly persons towards what they do. They travel, they have a lot of activities, and see the capacities and the capabilities that we all have. But we also predict, diagnose, and treat more. So that's also a good thing, because that's the development, but it's also, of course, a challenge in that sense, because we can do it. We also have a global scenario of rising healthcare cost, because we become more and more, but also because we are getting old and old, and we can diagnose more. We also have a climate change that will impact us all in that sense. So in some aspect, we all need to have understanding that societies must use our resources more effectively and also equitable. And that's what one of the keywords are today in my talk. So society is evolving, yeah, in many countries over the globe. And I mean, we see it also from the global burden of disease studies that are one of the data sets that we have, that we live longer and have better health. But one challenge is that while we are increasing in population, we also have a lack of people that will treat us in healthcare and social welfare. So in Swedish, these are some figures from Sweden. If we want to have the same level of welfare in elderly care today in 2040, it's estimated that we need to increase our GDP from 2.7 to 3.6%, which is around 75 billion SEK annually. That would be that 1 of every 4 full-time equivalent jobs are needed in health and social welfare in 2040, which is a lot. And in that sense, it's the equation will not add up. So we need to innovate. We need to think differently about how we are going to do healthcare and social welfare. But it's also true that that's from a Lancet Commission from 2020, that 5% of all carbon emission globally comes from healthcare. So in that sense, talking about climate change, we also need to understand how we can be more effective in order to have a sustainable healthcare system. And that, of course, also increases, as we have seen, that we have increasing health disparities. And I will come back to that. Because health disparities and what we here call more equitable healthcare and social welfare is important. Because the reality to the left is that we have a huge discrepancy between countries, but also within countries, about how health care is divided and who gets health care. So we talk about equality, so the right to have care on an equal basis. But then it also is important to understand equity, that even if you have the right for it, we need to see the resources and the needs of our patients in order to give optimum treatment. So how does reality look like today? And this is from a recent study from 2019, from the PURE study. One of my colleagues here at the University of Gothenburg, Professor Annika Rosengren, first author here. And this is a huge prospective data set here. So prospective studies are interesting here. And it shows very clearly the impact of both if you have diabetes or cardiovascular disease, in high-income countries, middle-income countries, and low-income countries regarding the case fatality rate. And the interesting thing here is that you see that it's a huge difference between high, middle, and low-income, but also that there is no significant difference in high-income countries between education level, but there is in middle income and low income. So there you have one aspect of health disparity. Other way to look at it, this is from diabetes, that nearly 450 million people were not treated for their diabetes. And if you look at different countries, and in the left upper countries is high income Western countries, you see that the increase of treated diabetes is rising. But there is a huge disparity between other countries where the red bar is untreated diabetes. So this is in one aspect seen that we have huge health disparity. And that's also why equitable healthcare is one of the focus area of the World Health Organization, of course. But isn't it all about genetics? So yeah, we can see that this is one of the studies. This is from a Swedish article by Anders Rosengren, professor here at the University of Gothenburg in Läkartidningen, but he looked at a recent study with over 350,000 people in the UK Biobank study, the impact of genetics, but also lifestyle habits on mortality. And if you have a genetic risk, you have over 20% increased risk of premature death. lifestyle impact, if you live an unhealthy lifestyle, it's associated with a higher risk. The interesting here is about health promotion. Healthy lifestyle behaviors can increase life expectancy by approximately 5 years, irrespectively of genetic risk. So you can't say either which, but if you have a healthy lifestyle and we work with health promotion, it seems that we also could have a huge impact on life itself. So the vision is that we need to go from silos, yeah. So going from reactive healthcare and social welfare to proactive healthcare and social welfare. And in that sense, we need to talk about partnership. And partnership is all about perspective, yeah. So some of you look at the old woman in this picture. Some of you will look at a young woman in this picture. And if I show you the picture here, you see more elderly person with the mouth and the chin and the eye. And from behind, you see a younger female. And the interesting thing here, and I mean, this is some of the studies that also some aspect only Kahneman got his Nobel Prize for, is that we look at the same picture, but we have different perspectives, we have different experience, we have different realities. And the important thing here is that you need to talk about it. And this is also important when you do a hackathon. I believe that if you want to do innovation for the patient, close to the patient, you need to have different stakeholders, including the patient relative, in order to understand the impact and the design of the innovation. But this is also true for equitable person-centered care. So what is person-centered care then? So person-centered care goes from putting the patient in the middle, where we identify the needs, to put the patient in the dialogue and one of the expertise, and see the patient's capabilities and expectations together with the relatives, of course, but also the goals. So it becomes one of the experts together with physicians and nurses and physiotherapists and psychologists and you name it, social workers. So it's about the partnership, which is crucial here. So if you want to build a system that is sustainable, we need to innovate close to the individual. So building a person-centered care system that also is increasingly health promoting in order to increase quality and contain cost, we need to figure out some of the critical enablers. And this is from the roadmap that was published in the Lancet by Professor Inger Ekman. And there are some critical enablers, which also I think would be interesting in the hackathon to look at it. Of course, technology and digitalization, the infrastructure and the service delivery, what kind of incentive systems we have. But one aspect that I would point out is the cultural change, how we acknowledge the elderly person, for example, in this aspect, and how we interact and how we co-create together. So do we have evidence for this, for person-centered care? There is a lot of evidence, both regarding to the decrease of cost, the decrease of length of hospital stay, but also the improvement of the self-efficacy of the patient, the improvement of work environment for the people that care for the patient, but also the increase in equity in the care process. And that, of course, is important because we need to build a more evidence-based way of doing healthcare in order also to solve some of the challenges that we have. So summarizing some of the evidence that we have found is that it can be utilized in all contexts, both within the hospital, primary care, hospital at home, home care, digital care, physical care. There is an increasing evidence of the effects and efficiency, so increasing quality and cost containment. But it requires a systematic approach, and that's important in order to go forward, and that's where innovation come into. And in order to do that, you need to understand that it's about co-creating. So it's an ethical vision of how to do it in practice, together with patients, the professionals, and the manager. And that needs to be part of all levels, both on the bedside, so what I call here micro level, but also on the organizational level, meso, and on the macro level. So in that sense, it is one of the key aspects, and that's why the World Health Organization took person-centered care, which they call people-centered care, in order to understand how you can reach those SDGs and some of the SDGs about, not at least, equitable healthcare. So going from reactive to more proactive, I mean, that's the key here, because right now we are still very, very much into a reactive phase in healthcare. And in order to make the change, we need to understand precision health and digitalization and how that works with person-centered care within a more tightly integrated care chain. So once again, the piece that I love, person-centered care, precision health, but also working with prediction, prevention, promotion, together with diagnosis, treatment, and rehabilitation. And I will just go into a little bit about prevention and promotion. So preventive healthcare is preventing disease from occurring. For example, vaccination is something like that. Health promotion is about promoting and maintaining and facilitating good health and well-being when you have a disease already. And here I'm going to show you one of the studies from the University of Gothenburg. It's about a lifestyle tool. It's called Livsstilsverktyget in Swedish. And it's about health promoting. And it's a digital tool to maintain healthy habits in their daily lives, which is, of course, important. And it combines the evidence that we know about lifestyle choices, but also with personal reflection. And this is an article from Nature looking at a smaller sample of patients, around 300 people, patients in the study, showing that you have significant effects on both blood pressure, weight, for example, when you work with a digital tool. And the interesting thing here is that of course, the scalability of a digital tool is good. This study is right now, I believe, increasing and have almost targeting 120,000 people that are enrolled into the study in order to understand also how you can use digital tools in order to work with health promotion. And that comes down to, of course, that the future is data. So it's a whole system approach. We have Internet of Things. We have data everywhere in our mobile phones, in our sensors. Precision medicine and precision health will, of course, be a lot about modeling data and analyzing data. The important thing here is that we need to understand what kind of data and whose data. And here, equality and equity are very, very important, and not at least for vulnerable elderly people. This is an article, it has, I mean, it came 2019, it's just for an example. They build a model for prediction of future acute kidney injury, but they used a huge data set of people in this data model from the US. Over 700,000 adult patients were in the data model. The devil lies in the details, however. So if you look at the gender differences in the population that they used, only 6% were female. So that's also an important aspect. And I mean, we know that what kind of data are we using when we design our data model in order to build the AI algorithms or the machine learning. But it's also true, and this is also a Nature article, is that we need to understand that we need more data and different data. And how do we incorporate the patient's wisdom and expertise? And not only the biomedical data that we have. So what about the patient's narrative, the symptoms, the goals? So that is something that is increasingly important to understand, both using retrospective data, but also prospective data that we need to understand more about. So in that sense, when we talk about involving the patient and relatives more, we need to understand that there are facilitators and barriers that we need to understand, both in organization and leadership, about understanding the attitudes and culture, which we want if we want to change into a more person-centered, equitable healthcare system. How do we train and educate person-centered care and patient public involvement? And also, how do we do research and innovation that facilitates a more person-centered care approach? And these must happen on all levels. So this is the English version of a European standard. But the important thing is that we need to have innovation, both on the individual bedside level of care, but also on operational, tactical, and strategic, so on the policy level. And in that sense, we need to understand more about the innovations that we need. So just summing it up, call for action, which I believe are important, is that I think that we need to integrate person-centered care as a key strategy for equitable, sustainable, and a more resilient healthcare system. And that also means the innovation that you guys will do in the hackathon. And it's all about co-creation and collaborative efforts. And in that sense, the team and the stakeholders that you involve need to come from different sectors, of course. But here, not forgetting the patients and the relatives itself, because they are on the end of it together with the professionals. And what we need to understand more is about the linkage between person-centered care and public involvement and the commercial, social, and environmental determinants of health. Thank you.
Yay, thank you, Axel. Wonderful, very inspiring and informative. So now we've got 5 minutes, 4 or 5 minutes left to give for this webinar. So if you have any questions, please either raise your hand or you can put them through the chat while you're thinking of something there. Maybe I can just ask you, Axel, generally, so with this hackathon, so what you picked up on a lot of areas, but if there's one area where you think there could be a world-beating new idea for healthy aging, what area would it be in? And I'm putting you on the spot now, I know.
Yeah, that's putting me on the spot here. Absolutely.
Yes.
I think that I need to think about it in that sense. But of course, I think that one area, and that I mean, I was touching a little bit about climate change and the impact of climate and sustainability, and I think that, I mean, we have so much service delivery, meaning that we need to go somewhere to meet our doctor or physio or whatever, and of course digitalization is good here, but I think that we need to understand how can we optimize care so it's not about going to a hospital or primary care center. How can we work more with health promotion, which is more optimized? But I think one aspect that I would push now when I think about it is that we, for example, we know more about monitoring. So many of us monitor our health. I mean, smartwatches, iPhones, whatever. But the question is, what happens when you interact with your doctor and nurse and the discussion? And are we able to use these kinds of data in the real discussion? I think that would be an interesting aspect, how we can facilitate that and make it easier.
Fantastic. Thank you. That was a good answer for not having prepared that one. So thank you. Any questions for any of the audience? Nope. What advice, Axel, would you give to, I don't know, people who might be thinking, maybe I will, maybe I won't join the hackathon. So what sort of encouragement can you give to tip them over the edge to be part of this?
Just do it. I think that the hackathon, you need to do it. I mean, this is it's fun. It's highly needed. And I think that focusing time on doing it is perfect. And I think one aspect is the matchmaking. So how do you create the team, the co-creation? And as I said in the end, I think that if you want to create innovations that are equitable, you can't really do it if you don't have the patients or the relatives and other stakeholders on board. So how do you build your team, I think, is one of the important things. And I don't know how the matchmaking is if there is a matchmaking, or how do you do that?
Yeah, there is. We've got with our event hackathon platform, Event Tornado, that Michele runs. So there's a fantastic matchmaking there, and people can join as individuals without an idea or with an idea, or they can join as teams with or without an idea. And like you say, that matchmaking is where a lot of the magic really happens. But with that, Axel, I'm going to thank you so much, and we're going to wrap this up with 1 minute to time. Michele, do you want to help us wrap this up?
Yes, absolutely. So as you can see here, we have 3 main resources for you. The first one is the webpage that you can visit to understand all about the hackathon. But then also, if you can follow us on social media, that would be great. I post here in the chat on Zoom all the links to these profiles and websites. And also, if you want to register for the hackathon, you can go to eventonedo.com/events, then click on your local hackathon. As you can see, we have the flags there, and then you can follow the process and register for your local hackathon. So yeah, maybe some final words about the partners, Jamie, if you want.
Yep, there we just got amazing global partners and local organizing hosts. I know some of the people on the call now. Thank you to you guys for helping us making this happen. We really wouldn't be able to do it without you. So keep up the energy and the momentum, getting people to register. And yeah, I think we'll leave it at that. But thank you to Axel again, and thank you to everyone for participating, and for Michele. And let's go hack some stuff. Yes, thanks very much.
Thank you so much, guys. Thank you.
Bye.
Bye.
Bye-bye.
Bye, 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 bye.